Feeding your premature baby at home. As you have probably noticed, your preemie can be sleepy during feeding time. Sleepiness during feeding time is normal for preemie babies as they do not have the maturity to eat the way term babies eat. It is not uncommon for preterm babies to be referred to as sleepy feeders. Preemie babies may not be able to cue or show hunger, and this puts them at risk for poor feeding and poor weight gain at home. Many preemies are able to give some hunger cues prior to their discharge. Your baby is cueing if they are awake and alert around feeding time, sucking on their fingers, smacking their lips, rooting or turning their head and opening their mouth for a nipple, or fussing or crying. Babies who do not give hunger cues may not eat well, so parents of preemies may need to set alarms and wake their preemie. This is especially important for nighttime feedings. You may have some questions about feeding your baby at home. What are you feeding your baby? When do you start breastfeeding? How often can you breastfeed? How much should you feed your baby? Should you feed your baby on a schedule? And how do you make formula? The NICU will help you learn to feed your baby. This will help you get accustomed to what your baby is eating. Many moms choose to give breast milk and other moms choose to give formula. Although breast milk is preferred, we are here to support your choice for what you would like to feed your baby. Breastfeeding a preemie can be challenging. The sleepy feeder can be even sleepier at the breast. Preemies are particularly comfy and cozy up against their mommy's bare skin. Attempting a latch can be more difficult than a hard nipple on a bottle, so it is important to establish a latch early when oral feedings are started. Do not wait until discharge to attempt breastfeeding. Here are some tips for successful breastfeeding at home. Discuss your plans for breastfeeding with the NICU team prior to your infant feeding. Get help from our lactation nurses. Attempt breastfeeding at least once a day prior to discharge. Watch for breast changes and softening with breastfeeding, and seek support after discharge. Our lactation team can help you establish an effective latch at the breast. Some moms may need a shield. This is an effective tool, especially for preemies who have had many bottles prior to attempting breastfeeding. Your nipple looks very different than the nipple on the bottle. The shield will give your baby a firm nipple to latch onto and allow for effective breastfeeding. Your baby is getting enough to eat at the breast if you are able to hear or see swallowing, your breast is softening after feeding, your baby continues to have wet and poopy diapers, and your baby is gaining weight. Here are some tips for making more milk. Breastfeed and/or pump at least 8 times per day. Try power pumping. Pump 10 minutes, rest 10 minutes, pump 10 minutes. Do this for 1 hour. Drink plenty of water, 128 ounces or 16 cups a day. Eat high fiber foods like oats, beans, and leafy greens. Try to relax with music or video apps to decrease your stress, and pump near your baby. You will need to clean your pump kit. In the hospital, you need to clean it after each use and take all pieces apart. Wash in hot soapy water with a brush. Always wash your valves by hand. At home, hand wash or use the top rack of the dishwasher. You can also sterilize your pump parts by boiling them on the stove for a few minutes. Always allow your parts to air dry. Do not wash your tubing. Tubing will get some condensation. Shake your tubing and allow it to air dry. If it gets black specks, this could be mold. Throw it out. We are here for you. Here are the important numbers you will need for Fairview Hospital. Hillcrest Hospital. Main campus. Preterm infant formula is different from term infant formula. This formula gives your preemie optimal nutrition to support weight gain and bone growth. The NICU dietitian is very helpful in preparing you for what you will be feeding your infant at home. The dietitian will also give you special instructions or a recipe for how to make higher calorie formula or breast milk. If your baby is discharged with a special recipe, expect to see the dietitian office outpatient. Those families who qualify for WIC will receive their paperwork from the NICU dietitian prior to discharge. For more information about WIC, please see our NICU social workers. Because you will be feeding your baby in the NICU, you will be aware of how much your baby is eating. How much you feed your baby at home will be determined the day of discharge. Your baby is working hard learning to eat and will be at their highest feeding amount the day they go home. So, how much do you feed your baby? Start with the amount your baby is taking at discharge. Increase this amount gradually every couple of days. Add more if your baby eats the whole bottle. They might take more. And if your baby leaves a little left over, they are probably satisfied. Many preemies who leave the NICU are eating a range. An example of a range would be eating 40 to 60 milliliters or 30 to 50 milliliters each feeding. You can always offer the larger amount. Preemies who eat a range tend to have stronger hunger cues. There are some things to consider when determining your preemie's feeding schedule at home. Feed at least every 3 hours. Some preemies may eat more frequently. Feed early when alert and cueing. Wake up your preemie if they are not up by 3 hours. And do not allow your preemie to go longer than 3.5 hours until you talk with the pediatrician. Here are some reminders when making powdered formula. Always check the expiration date on the formula can before purchasing. Gather your supplies like your measuring cup, bottles, and a pan. Use sterilized water. Bottled water, distilled water, or fluorinated water are not sterile. Heat your tap water on a stove in a pan until boiling for 1 minute. Let the water cool for up to 30 minutes and then use to mix the powder. Now I'm going to show you how to mix powdered formula. Before you begin, you need to clean your surface and wash your hands and get like a dish towel, clean dish towel, lay that down for your workspace. You're going to need a pan, some measuring cups. Now if you do not have a measuring cup, the NICU can supply you with this measuring cup which can make larger volumes of formula. Your bottles, a spoon for mixing, and a knife for leveling the scooper, and of course your can of formula, and a clean, wet dish rag so that you can wipe off the can. I also want to make sure I've checked the expiration date, which is always on the bottom of the can. I want to make a larger amount of formula for the rest of my day, so I'm going to start with the 8 fluid ounces mixed with 4 scoops. So now that I've figured out how much water I'm going to need, I'm going to go ahead and from my tap, I'm going to add water to my pan and I'm going to boil that on the stove for at least 1 minute. Once this is boiled, I'm going to take the lid off and let that cool for 30 minutes. I'm going to use the bigger measuring cup that I got from the NICU. And now that my water is cooled, I'm going to go ahead and pour 8 ounces of water to make my 8-ounce recipe. This is a fresh can of formula, so I definitely want to wipe off the top of this container and that foil before I open the can. Remember too, to go ahead and wash your hands again. Now when you're measuring your scoops, you want to get a big scoop and then you want to level that. You don't want to pack your formula. So you just get a big heaping scoop, 1, 2, 3, 4, 5. That will ensure that you get all the little air pockets out. Measure that off and go ahead and put that into your 8 ounces of water. Now I'm going to do that 3 more times. 1, 2, 3, 4, 5. And there we go. Heaping scoop, 1, 2, 3, 4, 5. We'll level that off. So that's the 3rd scoop and the last scoop. 1, 2, 3, 4, 5. Perfect. So now I have my powder mixed with my water, and you can see that it's clumpy. So now I'm going to take my spoon and I'm going to go ahead and mix it up until it's smooth and there are no clumps in it. You can also get a little container to store your formula in the refrigerator. This is a mason jar that I actually have a lid for it. I can put the lid on it and shake it up a little bit. And that will help get all the lumpiness out of your formula. My baby is taking 2 ounces of formula, or 60 milliliters. So I'm going to challenge my baby. I'm going to go ahead and I'm going to give my baby a little bit more than 2 ounces. Now before you feed your baby, always check the temperature of the formula, because we let it cool on the stove, but we want to make sure that it's cooled down enough to safely feed your baby with. So a great place to always check a temperature of formula or even bathwater is on your inner forearm. So I've just now tested the temperature and it feels just a little lukewarm, and it's fine if it's room temperature. Now that I have this big batch of formula, the storage of this formula is going to be extremely important. This formula is good for 24 hours in the refrigerator. If I don't put this formula in the refrigerator, it's only good sitting out for 2 hours. Once my baby eats off the bottle and doesn't eat the whole thing, I'm going to need to discard that amount within an hour. After your can of formula is opened, it is good for 30 days, or from the expiration date, whichever comes first. Feeding a preemie can be very different from feeding a term infant. Due to being early, preemies can sometimes have problems with the 3 important skills for successful feeding: sucking, swallowing, and breathing. You will work with the NICU team to learn how to feed your preemie. You will learn how to position and pace your infant during the feeding. Many preemies eat in an inclined side-lying position. This position allows for the feeding to pull into the cheek and not in the back of the throat, thus allowing for a better pacing. You may be feeding your preemie in this side-lying position in the NICU and at home. The NICU team will help you learn how to feed your baby in an inclined side-lying position. Side-lying feeding position allows for close observation of your baby's sucking and swallowing and breathing. When feeding in an inclined side-lying position, make sure that your baby's ears are in line with the shoulders. This will help your baby breathe easier during the feeding. Swaddling your infant can help keep your baby's ears in line with the shoulders. This allows for the hands to be brought to the face, encouraging rooting. As your baby becomes a stronger feeder, you can try a true upright feeding. The more you feed your baby in the NICU, the more comfortable you will be feeding at home. Even term infants can have mild choking events at home during feeds. Avoid distractions while you feed your preemie. Watch for sucking, swallowing, and breathing, and watch the color of the lips. Your baby may need to be paced. Tipping the bottle down prevents flow from the nipple and allows your baby to take a breath. During a mild choking event, stop the feeding. Sit the baby up and gently pat the back. Your baby may need suction, so have a bulb syringe or suction device on hand. If the choking becomes severe, begin back slaps and chest thrusts, as reviewed in your infant CPR class, and call 911. We'll now talk about the home bottle. Please bring in bottles you have purchased for your baby. The NICU will start using them in preparation for home. Home bottles are very different than hospital bottles, and we want to make sure that the bottle you purchased is a good fit for your baby. If you have not purchased bottles, your NICU team can help you choose the best option for your baby. Most babies leaving the NICU will go home on a vitamin D supplement. Vitamin D is important for calcium absorption, which is necessary for bone growth. Some preemies also need iron. It is not recommended to give vitamins directly into your preemie's mouth. Many preemies do not like the taste and may hold their breath. The safest way to give vitamins to preemies is to add the vitamins in about 10 to 15 milliliters of the feeding. Prior to your baby's discharge, vitamins and any other medication prescriptions will be sent electronically to our hospital outpatient pharmacy or your pharmacy of choice. The NICU will let you know when the prescriptions are sent. Once you get your baby's prescriptions, please bring them to the NICU for teaching. Purchasing an infant scale will help you monitor your preemie's weight gain at home. A basic infant scale is all you would need. Most basic infant scales can range from $35 to $40. You can find infant scales at many stores or online sites. Infant scales are especially useful for breastfeeding moms or those families whose preemie is seeing a dietitian after discharge. Your baby's pediatrician may want to monitor the weight closely and may require frequent weight check visits in the office. Let your pediatrician know you have an infant scale at home. This may limit some of the extra appointments. Let me show you an example of weighing your baby on an infant scale. First, undress your baby, turn on the scale, take off the diaper, and go ahead and lay your baby on the scale until you get the reading. Soon enough, your preemie will grow and mature into a vigorous, hungry, and demanding little feeder. Keep your preemie feeding and you will keep your preemie growing. Growth is so important for your baby's brain and body and lays the foundation for your child's overall health and wellness for the future.